My name's Dr. Jacqueline Mullan. I am Global Lead for the School of Health and Social Wellbeing at the University of West of England, Bristol. So my role involves working in partnerships with other universities around the world, but also in recruiting good international students to come to UWE to study with us, and to then, when they arrive, to support their journey so that they have a really good student experience and they're really successful. The other aspect of my role is the internationalisation of the curriculum, so that all students, including our home students, have an opportunity to get the international perspective on education and healthcare. So my professional background is a physiotherapist. I started work in London for a number of years for the National Health Service, specialising in major trauma and critical care. And then I have worked at two universities in the UK, UWE being the second one. During that time, I've done an MSc in health promotion and more recently a doctorate in clinical research. My research interests is primary care and how professions other than medics can really contribute to advanced practice in primary care. We provide a number of undergraduate programs in allied health, so programs like physiotherapy, occupational therapy, diagnostic imaging, optometry, paramedic science, and we also provide adult nursing, child nursing, mental health nursing and learning disabilities and midwifery. And then at postgraduate we have masters in public health, environmental health and rehabilitation, amongst others. So we provide a number of undergraduate programs for allied health, so subjects such as physiotherapy, occupational therapy, diagnostic imaging, paramedic science, optometry. We also provide undergraduate programs for nursing, so child, adult, mental health and learning disabilities nursing, as well as midwifery. And then we have a number of postgraduate programs such as masters in public health, environmental health and rehabilitation. The facilities we provide are very state-of-the-art, so we have lots of simulation rooms that are set up like wards or treatment areas, and they have a lot of equipment and students have an opportunity to practice in the simulation environment before they go out into practice placement. Alongside this we have lecture theatres, seminars, study areas and a library which has a huge amount of electronic and physical resources all related to health and social wellbeing. So all undergraduate students have placement opportunities in the health sphere. The length of placements will vary according to the placement, but all placements can be either in our National Health Service or with private hospitals, with charities, perhaps with voluntary organisations. We also have an in-house sport rehabilitation clinic and a state-of-the-art eye clinic for our optometry students, which is a fully functioning eye clinic where patients can come in, get their eye tests, have their glasses dispensed, etc. So the placements are varied. We aim for students to get a range of placements so that they build up a portfolio of experience that will make them very employable for when they graduate. As health and care professionals in the UK, there is a big demand for when you graduate. So many of our students do go to work in the National Health Service or in private or commercial organisations, depending on what degree they have done. For international students, they can do this on a post-student work visa for 2 years, and then sometimes they get additional sponsorship from employers to stay in the UK. We also enable students who want to return to their home country to complete all the papers. So health and social wellbeing graduates are very sought after and they have excellent employability potential. And we have a lot of employability support to help students get their first job. Secondly, if students want to return to their home country, we will help them put together their transcript and to apply to their own professional bodies within country so that they can actually come home to work. So we would advise students to look at information on websites, professional bodies related to that specific programme, and not just that profession in the UK, but that profession worldwide. So the prospective student gets an idea of what it is to be a physiotherapist or a child nurse or a paramedic from a worldwide perspective. If they can get some work experience, that is brilliant, but we recognise that work experience is really hard to get in many countries, and indeed it's very hard to get in the UK, so that is not something that is vital, but if that is possible, that is great. So the other thing is just reading around, getting to know what it is to be a health professional, getting to know what sort of values and what sort of personal skills you might need to learn to be a health professional, and think, can I see myself doing that job? Is that me? And obviously the other thing is we need people who can care. So the benefit of a career for a health and wellbeing professional is you always have a qualification that is very transferable across the world, but also transferable from setting to setting. So many health professionals start working clinically and then maybe they go into management or leadership, or some of them, like myself, go into education. There's always the opportunity as a health professional or health and care professional to develop research and to progress beyond bachelor's into master's and PhD. So the course that you choose is very diverse, whether that's location or the specialty that you end up going into.